Get the drive with Lucasade Energy. Buy Lucasade and enter for a chance to win the grand prize of a Toyota Hilux. Plus, win up to 500,000 instant prizes, including Fitbit watches, GoPros, earbuds, Amazon gift cards, and free Lucasade. Just buy one of the Lucasade Energy promo bottles and look under the cap for your code. Enter it online or send it via WhatsApp, see press, and social media for details. Buy, win, and get the drive with Lucasade Energy today. Lucasade, taste the energy.
Move with us, Cayman. Fidelity Bank is now Proven Bank. We will continue to serve you with the banking services that you've come to rely on, while moving you to another level of banking experience that you deserve. As members of the Proven Group, Proven Bank keeps your life and money moving. Learn about the Proven difference yourself at provenbank.com. Move with us. We are Proven.
For over 25 years, Island Heritage has weathered more than 25 hurricanes throughout the Caribbean. We've been there for our customers, settling thousands of storm-related claims, delivering best-in-class customer service, and paying out over $1 billion to support our customers. We are Hurricane Strong. We are Island Heritage. Visit islandheritageinsurance.com today.
Attention, Cabinet has extended the pensions holiday until the 30th of September. The Department of Labor and Pensions reminds private sector employers and employees that the option to pay additional voluntary contributions remains. However, the other party is not required to contribute as well.
Let me break it down now. Yeah.
Turn me up.
Connect to the culture. I go by the name of
Star 927.
Indeed, Star 92.7, Medical Mondays. This is premium radio. This is good content, good for your system, good for your body. And today's big question, let me just throw this out there. If you had to answer, what is the most important thing to you? It's relative. And I bet if I took a survey of our educated, smart, extremely professional Star 92.7 listeners, they would all come back with different answers. Some would say, most important to me is my family, my child. Some people, maybe young, in their 20s, would say, to me, the most important thing is me. It's all about moi. It's all about my brand, my position. And you know what? To each their own. But I bet that the reason you got up today, the reason you're in the car right now, the reason you spend all this energy hustling and bustling today was for money. Every day, people wake up because they know that money is important. So today's show revolves around the CI dollar. How much do you get? Do you get your value for money? Inside the studio, we have our friend, our good friend, Mr. Shomari Scott. He is the Chief Business Officer down at Health City, and also Dr. Binoy. He is the Clinical Director. Nobody better in the whole of Health City to talk about value for dollar. And the guest in studio today, Shomari, good day. Dr. Binoy, good day. Good day.
It's good to be back,
Yeah.
man. And I see you're energetic, and
Yeah.
2 months off, you look younger. So.
Yeah, man, I've been working in the gym, working on my fitness.
There we go. But the interesting thing is that you're talking about value, and you automatically equated it to money. And that's the interesting part about this segment is that what's the true value of Health City when there's so many invaluable things you can speak about, such as the saving of lives, right? Or the quality of life, which doesn't actually involve hard dollars. You can't measure that, can you?
Yeah, the question for somebody who claims that they can save your life, and you have options here in Cayman. There's a couple options now to go to, and you say, what type of compensation is fair for the man who will save me or my child's life? It's a big question.
Right. But the interesting part is, based on the tertiary care that we do have at Health City, in a lot of instances, the competition would be going overseas, right? In order to get the level of care with the equipment and the physicians available within the different specialties to be able to save a life. And Health City now, we've been around for close to a decade. We're getting closer and closer to that big 1-0.
Yeah, man.
And we really just wanted to come on today
Yeah.
to speak about the value that Health City brings to the community. Yes, both from a invaluable perspective of saving lives, but also in monetary terms in regards to the amount of resources that are saved by Health City actually being here. So,
Well, you are a business. Let's say that of all the businesses to be in, healthcare has some of the other types of value in it. When it comes down through your insurance coverage and through out of pocket, whatever the case is, you go in, you get some health care, but on the way out, you still have to pay the bill. You know what parents want their daughters or sons to become? Say, what would impress mommy and daddy and say, this is what I'm going to study. I'm going to be a doctor, mommy. Oh, that makes mommy smile. That makes mom, not only because of but because not only because she thinks that you're doing something that, gives back, but because mommy has something that is deep rooted inside of her that says, my son will financially be okay. There is the role of a doctor ties itself in with having a good salary, driving a nice car, living in a good neighborhood, and being okay at the end of the month. So I can only assume that your doctors are
definitely
compensated fairly.
Definitely, but I want to also mention that if you actually sit and speak to medical professionals, typically it's usually something that's happened in their life that leads them down that avenue, whereby they saw mommy who didn't get the treatment that she needed and she passed, or they had a grandparent that at a young age they saw a physician or a nurse take care of that grandparent, and they're like, you know what, that is something I want to do. So a lot of time in the medical sphere, a lot of the professionals that are very good at what they do, it's typically something that would have happened that really gave them that energy to want to become a physician, outside of obviously the monetary types of rewards that you're speaking about. Because I don't want for the regular populace to think that a lot of times the reasons why people get involved in medical care is due to that salary at the end of the day, when we know if you actually speak to the majority of medical professionals, it's a higher calling at times that persons get involved. That being said, when it comes to Health City, and you actually look at the level of investment that we've made within the community, back, almost a decade or further ago, it would have been the financial tsunami that happened, and everybody would remember, or those that are old enough to remember would remember 2008 when there was the bubble burst in the US. And as they say, when the US sneezes, we catch a cold. And we actually had world recession. Financial markets were in turmoil. From a tourism perspective, we had a downturn within the Cayman Islands economy, and that recession was proving difficult. I don't know if persons would also remember, I was in government at the time, that I think it was 2009 that the UK took over our budget, right? And we had to get everything.
We had our hands tied behind our back. Oh,
exactly.
The terminology.
Right? And the then government was looking at, can we get a new industry here that would be recession proof per se, and would have other benefits in regards to the Cayman Islands. And it just so happened that Health City and Dr. Devi Shetty was looking at how he could prove his model of high quality outcomes in regards to medical care can be offered at a fraction of the cost, right? And in doing so, Cayman Islands was the perfect place to test that model, because in India, yes, he was able to reduce costs significantly for persons needing medical care, and he wanted to have proof of concept here within the Cayman Islands that we have from an overhead and cost of doing business perspective, we're akin to New York City, right? And in doing so, what he would have done is obviously having the investment, over $250 million invested into the medical infrastructure, largest private investment from a healthcare perspective in the history of the Cayman Islands, would have occurred. And when you look on the back end, you will have, publications such as USA Today, Harvard Business Review, Forbes and the such, writing articles, PBS coming into a documentary about how a hospital can actually be within the small Cayman Islands and provide such high quality care based on all of our quality of outcomes that Dr. Binoy will be able to speak to, but also do it at the fraction of the cost that you would have in New York or South Florida, as an example.
This is what I always challenge you on, because you're such a good salesman, Shomari, that the savvy consumer has his ears perked up when you say these big statements: cost saving, yet better health care, these add-ons. So I have to on the people's my responsibility for the people, I have to ask the question: how did the Cayman Islands incentivize Health City to come here? Why not go to Jamaica, where the cost of living is low and the transport to Miami is just still an hour away? What did the people or the government trade in order to get Health City here?
So every government has what they would call different tools by which to encourage inward investment into the country, and those are foreign entities that otherwise wouldn't necessarily go to a country, incentivizing them to come and spend money there, and all the economic benefits, construction, jobs, as well as economic impact of whatever that industry is within a country. And what the then government of the day did was that they gave concessions such as 15% off of work permits, as an example. And recently we're in a room where we found out that some of the large accountancy firms, for instance, may spend $400,000, $500,000, $600,000 worth of work permits fees in any given year, and Health City spends close to $1 million in any given year in work permit fees. Just as an example.
Now we
would have had 15% reduction in regards to work permit fees.
Now you're talking about pillars, my brother.
Yes.
Remember at the beginning, you said that this medical tourism was supposedly going to be the third pillar, but me and my fellow Caymanians, we know that the immigration department is our third pillar. So you drop $1 million every year. You've been in business now for
8 years.
Okay. Yeah. Then, in addition to all of the other big businesses around that employ many Caymanians and expatriates, there's a lot of money. What is it? How much? You remember from your government days? Is it over 80 million or 60 million a year that they generate in revenue?
I don't recall.
It's a big business,
but it's a large number. Yes.
And we hope, and I hope, that as the years go by, every year you will really start to question each permit and advertise the position and ensure that Caymanians are offered and treated fairly when it comes to an interview process. And remember, Shomari, we have to take care of our kids and pay our rent. So you have to, when you're looking at hiring Caymanians, it's more to consider than just what you might advertise to somebody else. Wages wise.
Right. And just to mention that even within Health City, we have units that are 100% Cayman. So when you look at security, when you look at transport, when you look at housekeeping and the such, we've been around for 8 years, and we ensure that as many Caymanians as possible are actually hired. From a non-medical perspective, we have anywhere between 70 and 80% of our staff that are non-medical would be Caymanians. Now, when you have a new hospital and you have to have a large portion of nurses come in, then obviously the ratio, decreases for the time being until you hire the admin staff and the such to be able to help to ensure that patient care is where it needs to be. And those ratios come back into account. And we've been looking over the many years about how we can actually incentivize Caymanians to get into the medical field. And one of the videos that you have there as well will actually outline all of the programs that we've done. And once again, this is now the invaluable components of what we as Health City are doing. And we've had many students that have come through doing 3, 4, 5 different products within our Healthcare Explorers program. And these are the same students that come back to us that then get into the medical field. Some of the technical areas, we have
So maybe when a bit of your the students, and if you have any standout student, anybody who's on scholarship right now. So the thing yeah, you really thought that just speak about having young kids on themselves. Yeah. Shadow doctor program, the students, doctor has gone into the school, teach the students, and even for instance, the core, right, would have been on from a pilot, and then saw Dr. Binoy came to Health City to ask if he could have some Dr. Binoy took him into a long surgery. Yeah. He stayed the whole time. And now, because of because he wants to be right there for us. So, I'll ask you the little, how do you get back? And then you go into the yeah, instead of me asking you about the program. In definitely. Because yeah, we were bowling on film and talking about yeah. He's with a Cuban doctor here who's qualified in here. Or something. Yeah. Yeah. If I knew doctors are qualified in India, having here is that going to so just to explain what I wasn't supposed to do to assist the conversation. Yeah. Good job. Yeah. When people say yes and they no, that's big. So we are in the studio with, if you don't know, Dr. Binoy is a very busy man down in the city. Sometimes in the to what I just heard, sometimes allowing you as you work. Dr. Binoy, welcome. Maybe you could just, give me a little more. What do you think is the future for Cayman is working in currently?
Not anybody actually. I'm sure that Shomari the products what we have to encourage to take various professions in the healthcare, clinics, and many other nurses, patients, all those things. What is the impact of health city? Uh, when the health city started in 24 was open to the public, uh, we had a tool. So I was in the operating room and it was not open to the kids were coming to the operating room. I was experienced operating room, and all those things. And after that, are interested in become you not single hands uh, now with more this programs are there. At least I can tell you around 20 in some form of healthcare profession. Seeing the changes, like initially over in these various programs, they have come as the internship summer program like that. After finishing their league, we have one of them as an intern in. It may start with exposure, maybe because they got a bit more about the industry, seeing it firsthand, that it has sparked some in career in astrophysics. I might not say anything about it, but if I was an intern for me, be the catalyst that I need to get in. So is this program available to high school students for those to get into the medical field? How does somebody get into to one of the every stage of their school? I mean, for those that would have been listening, you would have heard the teacher was showing videos from houses. If you're teaching about light, use light to show the kids how many medical surgeries or diagnostics magnets within kids, straight through all the way up to every level of school student coming through, just to give us an accord who would have been on a criminal event, give us speech at one of the prime age so high school, and gave a speech and came to our city. It was part of the care that just so well over probably we've done free of cost to the families of children that would have cardiac issues through everything to give that cost to be able to save the and he would have come to part of the given research and he once again so interested in actually view a surgery, right?
make sure that I said, this is great for this surgery that I'm going into. Let you know. Due to my home, spoke to his parents. They said, you want to do it, you can do it. Surgery. I was so blown away that this would have been a 3 or 4 year premium trip to become a physician. It's still specialized, but it would be this made it accessible for me to the actual clip that we had that when she was going to medical school, exactly to see volumes of cases. And she believes that's one of the reasons why she was, had that experience and she exposure and opening it up. I'm sure every once in a while you pop into the OR and take a seat in a Seinfeld episode where Kramer drops man. Dr. Binoy, I'm sure you have some type of guard that is over each patient. I mean, what were you standing up during the surgery, 8 hour surgery? Is there something, or is it just
Usually we finish even if it is now this the heart surgery, especially heart surgery, and after stopping the heart, you cannot go around.
You put to while you're working on the heart, is there a mechanism
You keep them
pick
on
up
the heart.
CVC?
You keep them on heart. When you stop the heart,
Yeah.
see heart number, stop the heart. While they are on the heart, the actual procedure that we know that you have to stop.
So just to interrupt, you're saying that the heart does not stop while from the arteries?
No, it's not like that. Actually, when you put them on, you have to stop the heart will still pumping, but not
Like some electrical
yeah.
are beating, are causing it to
Breathing not pumping enough.
ah.
Heart lung machine supporting the heart. We have to stop the heart. That is very crucial as much as possible. Because stopping heart work really good for the heart muscle.
And I because you have to put it in an ice bag, put it in. Time is of the essence. We have to take our first break, so we're going to hear. Did I cut you off? Go ahead.
No,
oh my God, are you?
No, I heard that in the heart surgery. Usually we not anywhere unless you finish.
And the most important point that young Cayman was involved in the entire career that he was originally pursuing and is now and hopefully will come back to Cayman to bring it. He'll be working under
that. That's I wanted to tell you before. It's really smart for this as a career path because even if they, especially in this tertiary care, like where you offer surgery or advanced robotic surgery and all that, you be able, or there was not enough opportunity to come back on that or the learn experience they get can come back their own their community. So that is another reason they are
Thank you. All right. Before I fool around with this, we'll try to take a call on the break. I'm going to after the break. We'll try to take this call. Yeah, stay tuned.
or Shomari. Now I'll click over there.
Send me a message.
Is he on?
On the line later.
On the line. Sure. I'm not doing that. Nine, 53, 37, no okay, so that is another. Yeah, he's hearing the. Oh, you're on. I guess. If he calls, then I should be able to. He's just messaging.
She just messaged me to say
Tell him to call if he's on.
just heard music.
It's just,
A piece of vibes got even he vibes wants to listen in.
yeah.
But I said that area of vibe as well. So outside of direct investment from medical tourism courses, and you were hearing from US patient capacity how much less expensive it was for family, and they themselves and or the US citizens. So as well as the fact that it's accessible to persons procedures.
That's a big number. Can you quantify this number? This is something that's been audited, you guys.
There was a research document, but once again, what's evaluation speaking about medical professionals, the fact that they left their home country, a lot of them want to go to the US. Now we have US citizens criminalized to avail themselves of service.
But every is expanding. So let's say the core tourism and make it available that if you agree and recover on a private, your orthopedics, you could, I want to tell you something. I went to go see one of your new surgeries before um, he maybe a 10-hour surgery, and it was a severe injury with his back together. So this is when you first opened your doors. But you're moving to Commander Bay, now you're offering. So in general, thing according to your business plan, or is this something that is a shifting focus a bit?
Yeah, narrative, the original plan was always to offer care of the gaps within the metaverse as well. And with the Alice, more and more the gaps that are in character as well gaps that we can fill that void latest technology across the widest spectrum. People have become what's the best medical um,
Mm, well, as a citizen, I pay my taxes, and when I come into more than 500, I say, yeah, man, let me give it. As I understand it, we were all a part of the concessions that you received. My contributed, and I'm pretty happy, right? And it's good to know, it's good to have that peace of mind. Money is something that everyone before health city came to man. If there was something that was for the HSA, I think the ideal life, and then let's put them on air. And I'll tell me how much does the air ambulance trip cost?
anywhere between 20 to 30 US, 30,000. Even more so than the cost, the government insurance providers over 24 million um, bills. But Dr. Binoy, we speak to Dr. Ravi, there's you have that golden hour, golden 2 hours, with bills, and typically you take you anywhere from 8 hours to 10 hours, and it's you outside of the golden window. So the quality of life moving forward really is very mentioned manufacturing, which is the other benefit that
Shomari, I think you might have sparked somebody's intro. Do my best to get this caller live. All right. All right. Good day. Good day. Who am I speaking? Mr. Marks, and welcome to the program.
management team of Dr. Binoy and our very own Dr. Shomari. Well, he's not a doctor, but he looks like a doctor. Shomari Scott, and the others who are tireless workers, first-class human beings, but even more important, first-class professionals. So I just felt I've experienced the magic of Health City through people that I love, and I just wanted to share that and say thank you on air. And anybody that has real significant issues, I live in Savannah. Whenever there's anything, we turn right and we head east because we don't know what we're going to get in town. But I can speak to the fact that we know what we're getting at Health City. So thank you a million times for everything that you guys do, all the staff, all the first-class professionals there, and enjoy your evening, guys.
Thanks for that.
Thank you, Mr. Moxon.
You see, real impacts, and it's good because we're such a small community. We know who he's talking about, and if you ever need a real testimonial, you can reach out and touch that person. Dr. Binoy, I'm sure you have a couple good men and women underneath you working at the hospital. Maybe if somebody is interested in healthcare, maybe somebody is interested in the nursing program. I know through UCCI, there's a course offered. Is there any criteria that you're looking for?
We just mentioned which Health City is a core component of the UCCI nursing program.
Mm-hmm.
Great program. Anybody interested in nursing should go. And Health City actually has within, I think it's year 2 going into year 3, that through Nurse Neelam and our nursing team, we also take nursing students and always look forward to those graduating and whether or not we can get some of them into Health City's doors. Now, when it first started, it was a lot of nurses who are already working at HSA and such that wanted an additional degree. But this last cohort, we're very pleased to see that there are persons who hadn't been in nursing before that are really, the majority of them are going to nursing. So we'll see that cohort in 2 years and be able to see who we can get within our roles as well. Sorry.
No, I know it just takes.
Cut you.
No, I'm not. I'm glad you added that you're a part of the program. It just takes something special to be a nurse. It takes a level of care, and it's not just about a degree. It's just not about knowing, hey, this much medication at this much time, and I'm going to quote unquote take care of you. So I just wanted to, from your perspective as a doctor, any advice or anything you want to add about anybody looking to join your nursing program or even become a doctor according to Health City's standards?
No, we would love to take all of these the nurses from our own university here or any other doctors who are at present working outside Cayman Islands, and if they are interested to come back home and join Health City, we are very, very happy. Hopefully we will see a few of them joining Health City soon.
Maybe it's I don't know, maybe it already is competitive. I imagine that once you graduate from this program, you send your resume out to a few hospitals, and as you interview, maybe the hospitals then fight for what they consider to be the best qualified and the best that fits in. At the end of the day, you still have to fit in, you still got talked by the water cooler, and you still have to be a part of the team. But anyway, I was at Health City a couple of days ago. I walked in with what I'm happy to know is something that I don't need too much medical attention for. But I walked out paying $29 to seeing a neurosurgeon. Yeah, it's not bad. And then he gave me he sent me straight to the pharmacy to go and get some medications. And when I looked on it, I said, oh, this is ibuprofen mixed with a little bit of this and maybe some witch hazel and some bush tea. But you know what the price was? $1. $1 for my medication and $29. This is through Cayman First, which I have to say must have some relationship with Health City. And you want to talk about that? Who is in your network? Who is not in your network?
In regards to
walking in and walking out with good coverage
Yeah,
Or
no, I mean, we accept all insurers on island at Health City, and we have a great relationship. The next video will actually be a cruise ship passenger who had an emergency that we were able to save. We have a great relationship with all of the overseas providers that even persons who come for an emergency from the US, even if we don't have a direct agreement and contract, a lot of times I think it's sticker shock when they're like, wait, that's what it costs. You save that life, and that's what it costs. Hurry up, let's pay that quickly before they realize that they're supposed to be charging us more, right? So we've had a great relationship with all insurers overseas, and we have a great relationship with the insurers on island. That if you have an ailment, you can definitely come and avail yourself of the services at Health City. Now, obviously, those that have cynical need to go to HSA first to be able to get that referral to come to us in non-emergent types of scenarios. But yeah, everybody's accepted. That's why I didn't know where when you say network, everybody. Yeah.
Well, let's take a listen to this and let's discuss after. Let's go.
Baptist Health, and when I came here, I wasn't sure what type of standards I would have, but the standards here were phenomenal. It's very comparable to what we have at Baptist, but here it's really, really good. The care here, man, I can't say enough thank you to the doctors and the whole team here that took care of me and my family, because we had no place to stay. They helped us out with a hotel, and all of that made me really feel comfortable trying to recover. I am always taking care of the patient's needs. I'm a biomed, so I always look at the other side. But now sitting as a patient, they really did well here. Just to put it in plain terms, they saved my life.
Okay, Shomari, that's what I call from the horse's mouth.
Definitely.
This is somebody in the medical field who lives in Miami.
Yeah, and at a facility that everybody recognizes the quality behind that facility as well, mentioning the great quality of care that he got at Health City.
Yeah, the name Baptist they have a strong brand. My sister suffers with heart conditions, and in my younger years, flying to Miami to Baptist is a thing. That's what we do.
Right.
Right now, that's not necessarily necessary. Courtesy of Health City. Dr. Binoy, you've probably done a few surgeries. Any heart? Oh yeah, just a few, just one or two.
Thousands, yes.
Any ones that you did on island here that still stick out in your mind? Any heart surgeries that you want to bring up and that you think might resonate with people?
I have a few, but I'll tell you one that's standing out. A young man, around 33-year-old, came in an ambulance when he was on CPR because they got 911. By the time this ambulance went and picked him up, within the ambulance he had a cardiac arrest, and they had to start this CPR and resuscitation within the ambulance. By the time they reached Health City, almost, I think time is very precious. That's what I'm telling. 7 minutes over. Then reached our the triage where continue this resuscitation. Heart is reviving at all. So it's almost half an hour over because we cannot get the history because there was no relatives, no friends. It came in ambulance alone. So that's the time we realized that we have to do something. This 33-year-old man is going to die. It's a very healthy young man. We took him to the operating room while doing the massage and everything. We put him on without knowing what is going on. We know only one thing: the heart is not beating. We put him on a machine called ECMO, or extracorporeal membrane oxygenator. This is a kind of or advanced kind of the heart-lung machine. It will support both heart and lung. So if the heart is not beating, we have to support that. The entire body should get blood supply and oxygen through that. So within the next 15 minutes, we put this slashed open both groin. That's much easy because opening the chest, connected him to the this ECMO machine. By the time it's around 45 minutes over. 45 minutes this
of only compression. The only blood is getting to the brain is when you physically
Well,
squeeze the heart
exactly.
a little bit, send something. Yeah. Okay.
So 45 minutes we did by the time we put this machine on. 2-3 minutes it took. Slowly we see that in the echocardiogram and ECG we can see his heart is slowly started contracting. And we spent almost 1.5-2 hours in the operating room now. Now we know that his heart is beating. The parameters become stabilized, but we don't know why heart stopped. We took him to the ICU. By the time his mother and girlfriend came, so we talked to them, this has happened. Now they know any history. We want to know whether he was suffering from any pre-existing heart disease or lung problem. Then mother was telling 7 years ago he had a clot in his legs and he was on thinner. And after some time he stopped it. Then immediately we realized, oh, maybe it would have happened again. We took him immediately from the ICU to the CT scan room. We did a CT scan study that showed his entire lung pipe, everything is completely packed with blood clot.
Oh.
Okay, so then we realized, okay, what is the problem of this cardiac arrest? It's something called acute pulmonary embolism. From the CT scan room, we took him back to the operating room. We took almost 10 hours surgery there. This surgery means we have to cool the body to 20 degrees centigrade, remove the entire blood from the body. I mean, there's virtually no single drop of blood in the body. And we have to open the pipes, the heart and the lung pipes, remove the entire clot from that, suck it out. Then we have to rewarm, put the blood back in. And now it's almost 4 years. He's living like anybody in the absolutely no deficits. A normal life is leading here.
And typically that type of scenario, person will have like 5% chance of surviving that emergency type of
They
scenario.
will not 5%, that's 0% because he's arrested 45 minutes.
Right.
Yes, less than you were saying earlier. 7 minutes is too much.
Yeah. So 45 minutes to to revive the heart.
Right.
I mean, to put the machine in.
Yeah, it makes me just go with the amount of technology that we have. It's not only that we are resisting it, but if he did have a little chip inside that had all of his medical history, you would have saved him in quite quickly. But it seems that I'm very interested in where he was in that 45 minutes. It leads a little into spirituality and it leads a little into the consciousness. But when does the brain stop and when does he come back? It's a question that we would need a priest, a rabbi, and a Sikh to get down to it. But
he took 3 days to wake up after the surgery.
Did he tell you what he remembered, or
I don't remember anything?
Anything? Oh, interesting. The big black void.
But the interesting thing is, Matt, is that based on Health City being there, that's just one example of a life that otherwise would not be there.
Exactly.
How do you measure the productivity that he's going to have for his wife and his children, as well as the fact that they have their father here today, a young man, 4 years late, hopefully many years into the future. Those are the invaluable measurements that it's much more than concessions. Knowing that Caymanian lives would have been saved by having Health City here would have been one of the reasons why decisions were made to enable Health City being here. Sorry, Dr. Binoy, I cut you.
No,
we only have a few minutes left. There is something that I would like to play for the public, and maybe we can comment on it as well. So in the time that we will have, let's just play a clip because we're talking about trauma.
Right.
Let's hear it later.
Nicholas Connor is lucky to be alive after a car accident in January.
Because I ran off the road and the ambulance came to rescue me because I was stuck in a car with a pole through my chest coming through my back.
Despite many years of collective experience, this was the first time the surgical team at Health City Cayman Islands have seen a complicated case like Mr. Connor's.
When I saw he was lying on one side with the thick iron pipe, very big iron pipe, from chest from here and gone through and through the chest and coming out of from his back.
The first obstacle the doctors faced was getting Mr. Connor through the CT scan so that they could find out the extent of his injuries. But because of the pipe in his chest, they had to get assistance from the Cayman Islands Fire Service.
We couldn't fit him directly into the CT scan. The firefighters then took the measurement of the gantry. They went again and cut the rods so that he could be able to fit into the CT gantry. And again, once we took him, so we couldn't make the patient flat because the rod was just right inside his chest. So we had to position in a lateral way and get the CT scan done. Definitely the technology will help in all these cases. We have the best of the investigations here, the 28 slice CT being one of them, which would help to get a very good reconstruction and a 3D module so that it will be easy for the surgeons to operate on.
And then we brought them into the ICU, and the good thing is the surgery went on very well. There's not much blood loss. We could manage without any blood transfusion during the surgery. And also he had at least 6 or 7 ribs fractured on the right side, which were fixed with wires. That is very good, because normally they can have chest infection after a surgery like this on the chest wall.
Due to the extent of Mr. Connor's injuries, Health City's orthopedics team also had to step in to provide their expertise, since Mr. Connor also suffered injuries to his right elbow.
There was extensive stretching of the ulnar nerve, one of the main nerves of the hand, which deals with the fine motor function of the hand. The wound was contaminated with grass and hair and mud. So we could not do the final surgery, the definitive surgery, when he arrived. So we took him for the surgery and debrided all the dirt from the wound. We fixed the fracture temporarily with a wire, and we stabilized the ligaments, and we reduced the stress on the ulnar nerve by transposing it anteriorly or to the front of the flesh.
And after hours of surgery, Health City's multidisciplinary team approach to saving Mr. Connor's life was successful.
So he was still fully conscious and he was speaking to us, and probably 2 days stay in ICU. After that, we discharged him from the ICU. He went back to the ward, and a couple of days later he got discharged, went home walking. He's fine, he's good, and we are very happy that he made a very remarkable progress after such a major trauma to his chest.
I was really happy and glad that we have a very good team to treat this kind of complex cases, because these are the cases nobody will have experience. I'm seeing first time like this.
This was Mr. Connor's first time at Health City Cayman Islands, and he says he will remain grateful to the team at Health City for saving his life.
And to encourage you and to show you that how lucky you are and how good God is to you, that why you're still alive, and they're very nice people. I love them.
Something about that Caymanian accent makes it hit home just a little bit more. Dr. Binoy, thank you for your work. Thank you for bringing your expertise here to Cayman and contributing. You've been here from the start?
Yeah.
Over 8 years?
Over 8 years.
Shomari, congrats on all of the successes. And I'm sure we'll see a couple more as we continue. And it's been a good program. Anything that you want to add that I missed off?
No, just the impact of Health City extends far past economic impact and money saved. You would hear directly from overseas patients in regards to how great Health City is for them, for their pocketbook, as well as the quality of outcomes. And then I think even more importantly, you're hearing from Caymanians whose lives were saved based on Health City being here. And how do you measure a life that's saved? And now it's been hundreds of lives that would have been saved by Health City actually being here. And we'll continue to do that for many, many decades into the future.
Right on. Quality of care. Find it down at Health City. Premium content. Find it right here. Next week, Monday, we come back to you with more Medical Mondays.